Welcome to another program of Focus on Health. We're going to be back at the other end of this commercial about a topic I'm going to tell you it's going to surprise you, pretty much faces everybody. See you after the commercial.
I'm Gloria Weston Smart, the Director for Keep Columbus Beautiful.
And I'm Michelle Mang with the Columbus Consolidated Government Public Works Department. We're getting ready for our annual Hazardous Household Waste and Electronic Recycling event.
It'll be held October the 1st at the Old Recycling Center.
We will be collecting paint solvents, lawn care chemicals, all cleaning products, automotive products such as antifreeze and car batteries,
computers, printers, fax machines, copiers, consumer electronics.
Help us to divert this hazardous material from our landfills.
Do your part to help the hoot.
Don't miss it.
Each year, more than 350 million pairs of shoes are tossed in our landfills, taking about 1,000 years to decompose. So don't throw them out, donate them instead. Drop them off on these dates at these locations and we'll send them to developing countries around the world. It keeps them from taking up space in our landfills and helps provide footwear to those who really could use it. Our goal, 1,200 bags of shoes of all sizes. Got a pair you can spare? Brought to you by the Keep Columbus Beautiful Commission and the WLTZ NBC 38 CW Jabama Diverse Power Community Green Initiative.
Welcome to the program Focus on Health. It's my pleasure to come in here to you and talk about a subject that everybody knows that I'm interested in. So the T's, you might have guessed, it's about diabetes and pre-diabetes. And to my right, I have the diabetes educator, Miss Ann Blair, and she's going to look into that camera over there and tell you everything about herself.
Hi, Pops. Thanks for letting me be here today. Again, my name is Ann Blair. I am a nurse practitioner and board certified in diabetes management. I am serving as the Director for Diabetes Services at Columbus Regional, and here today to just really highlight some important principles around diabetes. We'll look a little bit at prevalence, we'll look a little bit about diagnosing and some of the management opportunities.
Right.
And the educational opportunities that we have throughout the community.
And looking at camera and tell them about your classes, how often, and the number to reach you.
We have a class the second Saturday of every month at Midtown Medical Center. The class starts around 9 a.m. We're over or finished about 11:30ish. It's really a foundational level class. It's intended to build, at some point. It's, again, the second Saturday of the month, Midtown Medical Center, 9 a.m. to about 11:30 a.m. No cost. Register? No cost to register. You can call 706-321-3741, and you will maybe get voicemail, but I will get back with whoever calls with any questions.
That sounds good. We got a lot of information on diabetes. We're going to have to move lickety-split, but all this information is good. We can go to the first slide, please. Next, there we go, that one right there. Talk about some of these statistics. Can you see that, Ann?
No, but just to really point out, this is data from the CDC, the Centers for Disease Control. And it's data from June 2014 when looking at prevalence of diabetes throughout the United States.
Right.
And as you can see, there are a lot of Americans who are walking with diabetes and with prediabetes, almost 29 million with diabetes. And looking at the numbers for those with prediabetes, we're talking about 86 million with prediabetes.
Right.
So add them together, it's a lot of individuals walking with elevated blood glucose or blood sugars or varying levels of insulin resistance.
Right, and we see from the slide that a lot of people are really affected with diabetes or prediabetes. Can we go to the next slide, please?
Yeah, and looking at prevalence among different ethnicities, this is actually, again, a continuation of the data from the CDC, and it really points out the prevalence, within the different ethnic populations.
Right, and it's staggering when you go to think about it, how the prevalence rate for this year. You see that African Americans are 13.2%, followed by, the Native Americans at 15.9%, followed by African Americans, and then Hispanic. So that's kind of alarming.
Yes,
It's really alarming.
And again, looking at, as you even opened the show, talking about just how diabetes impacts us in so many different ways, either directly or indirectly. Even if we're not walking with diabetes or prediabetes, the chances are pretty high that we know somebody
that
or
is.
are related to somebody walking with it.
Let's go to the next slide to look at some of the values. Here we go. Would you like to speak to this here?
Yeah, now this is actually looking at what's considered a normal blood sugar versus that pre-diabetes range versus a diagnosis of diabetes.
Right.
Now, a diagnosis is not always going to be made off of one reading per se.
Exactly.
I mean, there are other variables, but this actually, shows us that a fasting blood sugar, I get up in the morning, I haven't had anything to eat or drink, or I go have that lab work at my physician's office, that fasting blood sugar, what's considered normal is less than 99.
Right.
When we look at a 100, point up to the 125, because a diagnosis is made off of a fasting of 126.
Yes.
And Pops, you and I have been in the medical arena for a while, and you remember back when it was a 140, that was a diagnostic point.
That is
but
exactly right.
that 126 we have found, and I say research has found that people with 126 or greater in a fasting state are just as likely to develop those complications as an
Exactly right.
individual at 140 or greater. So criteria was modified.
Let's go to the next slide. Impact.
So this actually looks at the direct and indirect cost associated with diabetes. Again, continuation of data from the CDC. So we could see that, it's very costly to the
Very
nation.
costly.
And not only, costly to the nation, but to the individual.
Individually is it, but
know.
when you go to think about the rising cost of healthcare, it is very impactful.
Absolutely,
Very impactful.
absolutely.
Next slide, please.
So this is one of the things that Pops and you and I were talking about at the beginning. When we think of diabetes, and so often, it's not always the association. We need to recognize, for example, I'm in the hospital setting, and the majority of patients that come into the hospital are coming in with a complication of their diabetes.
Right. Comorbid conditions.
Absolutely. And my interest in diabetes actually sparked, I was with a cardiologist in the community for 10 years, and actually saw that there was a common denominator in
Sure.
those that we served. And that was
pretty much the common denominator.
diabetes and the heart disease. So you can see, diabetes uncontrolled. Now let's specify, if we don't control it, it will control us.
Right. But what I like to stress, Ann, is the fact that even though diabetes affects every organ system in the body from the eyes to the kidneys, at the same time, through education, for educating through diabetes educators like you, and doing all the things that they're supposed to do, eating correctly, monitoring their blood sugars, taking the medication on time, it's one of the most easily manageable conditions.
Absolutely. And you said something that I'm very proud to hear you say. You said eating. Diet is a four-letter word. That is just, we want to talk about better nutrition.
That's
we want to
exactly
talk
right.
about meal planning.
That's exactly
We want to
right.
talk about how to take any situation and make it work for our good.
That's exactly right.
We got the holidays coming up. Well, what about when Aunt Susie makes red velvet cake? Well, obviously we can't eat the whole red velvet cake, but we can learn how to balance.
That's exactly right. And that's what it is balance.
It's balance, absolutely.
Next slide, please. Oh, good. Goals of hemoglobin A1C and glucose control.
Right. So what I've got on this slide is really just an overview of those things that we need to be aware of, that we need to know. When we're with our healthcare team, what's my A1C? And what is an A1C? An A1C actually, it's a hemoglobin A1C, to be exact and more specific, but it's a 3-month average of where the blood sugar has been. But we need to know the different aspects of management. Where does glucose monitoring come in? What do I do when I'm ill or sick and I'm on medication? How do I recognize what are called acute complications, that low blood sugar, hypo versus hyper. So, immunizations, talking to our healthcare team, even as an adult, we need immunizations.
And one of the things that I'm glad that you mentioned is team. It is team, and what I've seen over the years, and you've seen, is that it's grown into that the individual, first of all, is the head of the team.
Absolutely, key player.
And key player, and uses all the healthcare professionals to accomplish their wellness. And that's why I'm glad that you say emphasis on team.
It is a team effort, and our reaching goals, again, we need to recognize that it is a team effort, but ultimately we are the ones that are responsible for the outcomes. We can't blame the dog, we can't blame the cat, we can't blame anybody because ultimately we're the ones making decisions.
Exactly.
But here's my thing, Pops. People have to know what decisions to make.
That's
Until
exactly
we
right.
know, we don't know.
That's exactly
and
right.
Unless someone's given the tools, then I can give you stories about people who were making major changes, but those changes were not in the right direction.
Right in the right
because
direction.
they didn't know.
And that's where the education comes in.
Absolutely.
Next slide, please.
So what are the goals?
All righty, this is what we're talking about.
Right, and these are, criteria or, recommendations, of course, set through various professional organizations, the American Diabetes Association, American Medical, American Association of Clinical Endocrinologists. These are guidelines, but this is looking at that A1C, and ultimately, if I have diabetes, my goal is for that to be at 7% or less, ideally. Now, on the other hand, as a clinician, if I've got an older person or somebody who has multiple medical issues, or I'm concerned about risk for falls, or for whatever reason, I may still, of course, not strive for a 7. I need reasonable control, but
Right.
maybe not as tight
Sure.
as someone, without those risk factors.
And that's where the team concept comes
Absolutely.
in.
It's very individualized. It's not a one-size-fits-all, Pops.
So we go to the next line, we see one of the major things
And-
is glucose monitoring.
Yes, and that day-to-day monitoring that we may be doing, and again, you have to work with your healthcare team to come up with really
Love that
what's the
word,
best
team.
for you. When I have a patient that I'm starting on a new medication, or they're implementing some lifestyle changes, focusing on meal planning, activity, maybe they're newly diagnosed, I'm trying to establish a pattern, well, I'm going to have them monitor a little more often
Sure.
than once we get them, more, situated, if you will.
And that's the reason why individuals need to have the education,
Right.
and it needs to be a team effort.
Absolutely,
So we go
and
to-
using that monitoring as the tool that it is.
You spoke about hypoglycemia.
Yes. Yes, hypo, that is that feeling, even if we don't have diabetes, if we've ever exerted ourselves to the degree where, oh my gosh, I'm so hungry and I'm shaking. Well, that more likely was low. We burned off the fuel we had, but
That's
people who are
exactly
on
right.
medication for managing their blood sugar are at higher risk for this
For
hypoglycemia.
this to happen. So it's kind of good to know the symptoms: the shaking, the sweating, dizziness, hunger, impaired vision,
Right, that could
weakness,
say
anxiousness.
that I'm having a low, and I need to use that meter that I have to monitor.
Exactly right.
But if I don't have my monitor, then it's safer if I'm having those symptoms and I'm on a medication to treat it. So we need to know what is hypo and what do we do about it should we have it. Those are
That's right.
important pieces. So this next slide actually talks more specifically about treating hypo, because when
Next slide, please.
people have lows, they are often, it's a frightening thing.
It
and
is.
Instead of coming from that low to a more reasonable level, people tend to overconsume
That's
and
exactly
overtreat. And now they're high and they got to come back down.
So it's like a yo-yo.
Yeah, so we always say the rule of 15 grams of a rapid acting carbohydrate, like 3 glucose tablets, 3 to 4 glucose tablets, or a tablespoon of honey jam or jelly, or 4 ounces of juice. Those are options to correct, but we got to remember we need to recheck in 15 minutes, ideally.
Bingo,
And
bingo.
then, follow up. But making sure people
lot of
know.
good information here that Ann's given. Next slide, please.
So,
Oh, this is
Oh,
good.
my.
And you
Absolutely.
did some good slides, because you don't know how often when I go into the homes, I will see a diabetic walking around in bare feet. So let's just cover this here, because this is good right here.
my kids just really are tired of me telling them about not walking barefoot. But especially when we think about with diabetes, we very often see issues with circulation.
Exactly.
And, you know, a little blister, a little corn, a little callus that, you know, we decide to remedy on ourselves with that over-the-counter product, whatever it may be, can lead to a major mess. So we need to practice, you know, daily foot inspections, looking for rend areas, look for potential issues, and making sure we communicate with our healthcare team if we identify an issue.
Eye checks.
Annual eye examinations, we need to have those eyes examined. Now, blurred vision is an acute complication of high blood sugar hyperglycemia.
Exactly.
So I very often would see people that were experiencing these episodes of blurred vision, and they perceive that that was the blindness associated with the diabetes. But, you know, again, this is where that healthcare team discussion comes into play, but recognizing that blurred vision is actually a symptom that that blood sugar could be high.
That's exactly right.
So I would see patients, Pops, that were referred from their eye doctor because they found that they had the, after spending hundreds on glasses.
Kidney monitoring.
So looking at the kidneys and, you know, again, healthcare team would absolutely run blood, well, actually they do blood tests,
That's
but
right.
doing urine collections for the 24-hour protein.
That's exactly right.
Just looking at a urine specimen to see if an individual had protein in their urine. But again, just like the eye exams, those kidney exams,
You need to-
renal function, those are again things that your healthcare team will assess.
You keep using that buzzword that I love, and it's team. I love that. Next slide, please.
So
Doing sick time.
Oh
now.
my, yeah. Now sick day, you absolutely want to have a plan with the healthcare team, because especially if you're on insulin, and I've seen a lot of people with type 1 diabetes come into the hospital with what's referred to as diabetic ketoacidosis, because they really didn't have a good sick day plan, or, you know, when you're diagnosed with diabetes, you know, there's so much information that you are given that, you know, it's hard to process all at one point. So what I've really encouraged my patients is when we get a sick day plan, to put that in the medicine cabinet.
Bingo,
to
that's
put
a
it
good
somewhere
idea.
so that when I am sick, I can retrieve that and say, oh, this is what I need to do. I've got to stay hydrated. I've got to.
That is an excellent idea.
And that way it's individualized.
And you want to something, these are the kinds of things that you actually learn by coming to your classes. Because I'm going to be honest with you, I never thought about that. That's an excellent idea. Okay, let's go to the next slide. There's a lot of good stuff here. Immunizations.
Well, like I said, Pops, here comes flu season, right?
You're right.
You know, we got to look at what immunizations might be a good fit for me, because like anything, it's not always for everyone.
You're right.
So working with that healthcare team, I don't want to seem so redundant.
No, I want you to keep saying that, because that's great. It's a team
You know, we
effort.
got to emphasize those pieces.
Exactly
and,
right.
You know, really looking at, do I need to get the pneumonia vaccine? Do I need, you know, any of these other immunizations? The CDC actually has some guidelines for the hepatitis vaccine for people with diabetes.
That's excellent.
So there's, you know, there's different, you know.
And I noticed that there's other things on here, which is one of my big things is smoking cessation. A lot of people don't know how that impacts. That's huge.
From a health perspective.
That's huge.
And one thing I see when I talk a lot about smoking cessation is telling patients, telling people I serve, do you want a pay raise? I mean, it absolutely. How much do those things cost?
That's exactly
I mean,
right.
You know, not only for my health, but, you know, so there's that physical, but there's that financial component. And then again, even a lot of people don't realize that secondhand smoke and what impact it has.
It's just as harmful.
Absolutely.
It's just as harmful. So there's a lot of little things here that go along with it. And dental care.
Well, you know, dental caries, anytime,
Extremely
you know,
important.
we actually are at a higher risk, you know, if we have diabetes, even, you know, for issues with our dental, you know, care with our, you know, with our teeth. I mean,
we're going to take a break here, and we're going to come back right after the next commercial with all this good information that Ann has given us. See you after the commercial.
I'm Gloria Weston Smart, the Director for Keep Columbus Beautiful.
And I'm Michelle Mang with the Columbus Consolidated Government Public Works Department. We're getting ready for our annual Hazardous Household Waste and Electronic Recycling event.
It'll be held October the 1st at the Old Recycling Center.
We will be collecting paint and paint solvents, lawn care chemicals, all cleaning products, automotive products such as antifreeze and car batteries.
Computers, printers, fax machines, copiers, consumer electronics.
Help us to divert this hazardous material from our landfills.
Do your part to help the hooch.
Don't miss it!
Each year, more than 350 million pairs of shoes are tossed in our landfills, taking about 1,000 years to decompose. So don't throw them out, donate them instead. Drop them off on these dates at these locations and we'll send them to developing countries around the world. It keeps them from taking up space in our landfills and helps provide footwear to those who really could use it. Our goal, 1,200 bags of shoes of all sizes. Got a pair you can spare? Brought to you by the Keep Columbus Beautiful Commission and the WLTZ NBC 38 CW-JBAMA Diverse Power Community Green Initiative.
Welcome back to Focus on Health with Ann. And Ann, I want you to look in that camera because let me tell you something, Ann. I like what you're saying. All the things that you're saying are very important. I love that emphasis. You can't say it anymore better than teen. But if you're looking there and let everybody know how they can reach you and about your class.
Again, we have a class the second Saturday of every month at Midtown Medical Center. It's actually in the conference center at Midtown Medical Center. You can call 706-321-3741 and leave your information. I will follow up with you. Or you can go to the Columbus Regional website and actually get information specific to our class and other classes.
Fantastic. Okay, let's talk about basic guidelines for healthy eating. Next slide, please.
Well, Pops, one of the big things is that there are no forbidden foods. That's a big thing.
Say that again for the
There are no forbidden foods.
There we
per
go.
se. The focus, and I mentioned, being redundant with the team approach, but it's so true. But during my class, I always make sure I let my participants know that I'm intentionally being redundant when I say we need to have a focus on balance,
That's exactly right.
moderation,
That's exactly
and
right.
consistency. So we need, again, to learn how to work those occasional treats like Aunt Susie's. I don't even have an Aunt Susie, I say that, but the red velvet cake at the holiday. But, that's one thing too I want to say about the holidays. We have to keep the holiday the holiday. How many times I've seen people make the holiday October 31st through January 2nd.
Right,
And then
right.
they say, oh, I've gained all this weight over the holidays. Well, because we tend to make that holiday almost a, 2-month period?
A 2-month period.
So keep the holiday, and we need to enjoy that. But again, we need to focus on that balance, that moderation, the consistency. And yes, there are foods that really don't have a lot of nutritional value,
Right.
but
Empty
on
calories.
occasion, those can be worked in the meal plan, but they need to be learned.
Artificial sweeteners.
Artificial sweeteners, they are approved from the FDA. You can see that they're listed, but again, you got to get into moderation here.
That's exactly right.
And too much even a good thing is not always a good thing. So really looking at my plate,
Now, next slide, please. This is my favorite. This is what I use to lose weight and to, how shall I say, when I look at the plate, I know exactly how I'm supposed to. This is an excellent tool right here. So can we speak about this here?
Absolutely. What you can see is taking a plate and think back when you were younger, even with me. I mean, what were we always taught? If it's in front of you, eat it.
Eat it. That's exactly
And so
right.
we got to look at the size of the plates too. I mean, if you look at the plates way back compared to some of them now, I mean, portion size
Is very
important. But as you can see, if you take a plate, divide it down the middle, and then on one half divide that again, what you're seeing is a balance. Again, there's opportunity. Everybody is at a different point.
Right.
We need to understand what foods have the greater effect on blood sugar. And we need to learn, what is considered a portion or reasonable. I would see over the years, I've seen people that would say, I don't eat a lot, but it's true they don't eat a lot, but they eat a lot of what they eat.
Right.
So we need to get that balance and looking at protein and the carbs, but then looking at those fruits and the vegetables, not only the starchy, but looking at the non-starchy
But the non-starchy
vegetables.
vegetables. And we're going to cover that right there because that's extremely important when people see fruits. I'm going to give a couple of sweet potatoes, and it's a big difference between the starchy and non-starchy. So that half of that plate is non-starchy fruit and vegetables.
Yeah, so you got your fruits, and you've got your non-starchies, like your lettuce, your broccoli, your
That's
cauliflower,
exactly right.
you know, onions, peppers, your cucumbers. So people very often, and again, until you know, you don't know, that those, you know, those beans, those peas, those lentils, those are starchy vegetables, which are considered carbohydrates.
That's exactly right.
And carbohydrates, you know, that's the thing about a diet, Pops. It's like, oh, don't eat this carb, don't eat carbs, don't eat, you know, or don't eat protein, or, you know, it's, you've got to get the balance.
You got to get the balance in it.
No nutrient group should be excluded from my meal plan.
All righty, let's see now. Next slide, please. I think we got the next slide coming up.
Okay, so this is looking at those grains. This is looking at carbohydrates, and when you look at carbs, which are those macronutrients, larger nutrients that make up, you know, your breads, your starches. So
Right.
you got bread, pasta, rice, cereal, oatmeal, tortillas, crackers. Those are carbohydrate sources. And again, the non-starchy vegetables versus starchy, knowing the difference. The starchy vegetables are carbohydrates, but fruit is a carbohydrate source, and we need to recognize that. So looking at the next slide,
Next
too,
slide, please.
you know, you can absolutely, you know, get a feel for what's considered starchy versus
we go.
non-starchy vegetables.
Big difference. It's a huge
And
difference.
how it affects. So our next slide, I think, feeds into the fruits. And, you know, I would, absolutely getting ahead of myself, but recognizing that very often people are so misled by sugar-free or no sugar added labels,
right.
and they've got to learn to focus on carbohydrate,
That
total
is
carbs.
exactly, total carbs is the key.
Right, so this is what our slide here, we're looking at.
Now, and this is, when I saw this in your presentation, I was extremely happy because, you know, I've had individuals come on and they don't stress labels. This is where it all, I think anyway, because this is what I use, this is where it all begins. When I'm at the store shopping, taking time for the labels. I'm so glad that you did this. So let's speak a little bit about this. Let's take some time about this here.
Okay, so let's talk about those people in the store that so often are so overwhelmed by, they look at that label and go, oh my,
Right.
where do I go? I've been in the store, I've seen people at or on an aisle looking at a label, and I go hit a few other aisles and I come back, they're still looking
at the label.
trying to
That's-
figure out what to look at.
Right.
But
That's
what-
why this is good.
Absolutely, and what we look at, because there is a lot of information, so you got to start somewhere.
Right.
Where do we start? We look at what's considered the serving size of the particular food.
Right.
If it's a cup, a half a cup, one slice, two slices, whatever it may be. But looking at what that serving size is, and then what I try to get people to move to next is looking at what is the total carbohydrate.
Right.
And learning how to adjust and focus in on that.
Right.
So there is a lot of content, and we do focus a lot on looking at labels because most of the foods that we consume are packaged.
Exactly.
And they have a label. So making sense of that label and not to be overwhelmed, because when we get overwhelmed, then we say, oh my, I can't deal with this.
Yeah, you get frustrated.
So just understanding how to where's my start point, and then building from there. Again, laying the foundation on which we can build.
But reading those labels are extremely, extremely, extremely important. Can we go to the next slide, please? Tips to get the most from our carbohydrates.
People so often, and I was just as guilty, we drink so many of our calories.
Right.
You've got to be careful about beverages and our beverage options, and, you know, really looking at the fact that, you know, Gatorades and Powerades and, you know, those different beverage options that we recognize or think, oh, well, this is a nutritional supplement. We got to be, there's a lot of sodium in there, not to
Exactly
mention
right.
they may have the glucose, of course. I know there's some that have lower carbohydrate, but being careful of that, you know, regular soft drink and not realizing how much of an impact that has. Looking at juices. You know, we associate juice as, you know, this is a natural, this is a healthy option. But think about what we said. If my blood sugar's low, I can correct that low with 4 ounces of juice.
Exactly
so
right.
if my blood glucose is high, or I'm trying to get control of it and I'm drinking lots of
Oh my
juices,
gosh.
where's it going?
It's sky high.
So looking at our beverage options and, you know, again, focusing in on portion sizes. You go out to a restaurant. I'm getting ahead of myself. But if you know the portion size is going to be generous and you eat everything in front of you, like I was raised, can I have a to-go box?
That's
Put half of it in a
exactly
to-go box
right.
before you even start.
That's exactly
But there's a
right.
lot of little tricks to this. But really it all begins into, you know, getting that understanding of what is a carb and what's considered a serving and how do I balance it out?
Balance it out. Let's go to the next slide. Oh, here we go. This is talking more about the choices.
Yeah, and again, this is just a build on, you know, looking at the different options and finding ways to try to reduce, you know, the amount of carbohydrate consumed, and, you know, building in even to looking at the proteins and the fat,
Right.
And looking at added fat, you know, for example, maybe I have that nice, you know, salad, and I'm drowning it with a lot of high-fat dressing.
Oh my,
Now-
and I don't know how many times I've seen it. I know you've seen it as well.
Oh my gosh, yeah. And you know, what can we, well, you know, people say, oh, so you're telling me I can't have my dressing? No, absolutely not. But what can we do to try to reduce? Have them bring, when you go out to the restaurant or even at home, put your dressing on the side. And then take your salad and dip it to get the taste, but not to overconsume, because it's just drowning in it. The baked potato that I get, okay, the butter, can I have it on the side? And then
That's
you
a-
control what you add.
That
so
is
there's
a
lots
good,
of little
no, there's
tips.
a lot of, and you know, you've given a lot of excellent tips that, of course, someone in your occupation would give that I hadn't thought about. That's another thing, because I have, I know of someone very close that will drown it, the potato, in butter.
Absolutely.
And really, if you order it on the side, then you can gauge.
Right. You
Exactly
actually,
how much the
and
chicken.
fat itself, at the time, doesn't have a huge effect on my blood sugar, but fat has double the calories,
Exactly.
gram for gram. The other thing is recognizing that a lot of people with diabetes, they also have high lipids or cholesterol. And you know, that added fat, you know, can contribute, of course, to increasing those levels. But indirectly, too, we know that a high-fat meal plan absolutely can have an indirect effect on insulin resistance.
Insulin resistance,
So, which is in the majority of people that are walking with diabetes and prediabetes.
I'm going to make sure that this friend of mine that tunes into this, what you're talking about with the individualized serving of butter and all, because he definitely needs it.
Yeah.
This is good. I'm often asked this here. This is a very good
Looking
slide.
at the oils, and when you think of a saturated, those are those that really increase my risk for heart disease and clogging up my arteries. If it gets hard at room temperature, that's saturated.
That's saturated,
Right. So when I am making a selection and using different oils, these are, you know, better options. You know, again, not the saturation is what we're looking at.
Canola oil, olive oil, corn oil, soybean oil, and peanut oil. I'm often asked that, so I'm really glad. When I saw this in a presentation the other evening, I said, this is really a good one. Let's go to the next slide, please. There we go. This is still for other eating choices.
So one of the things too, and looking at, you know, decreasing my fats and whatnot, we need to recognize that, you know, that baking, boiling, broiling, grilling is a little bit, you know, healthier option than frying everything.
Sure.
So looking at opportunities to decrease my fried foods, that's an important component. And, you know, just again, I really want to emphasize the fact that we need to understand how to moderate all
Sure.
things.
Moderation.
We need to know what are those things that are going to have the greater effect on my blood sugar, and how do I balance them out. But I need to recognize that protein and fat are part of my meal plan.
Integral parts of
And
them.
we got to balance that out as well.
Right, right. Okay, let's go to the next slide. Use fat-free products when possible, such as sour cream,
Yeah,
mayo, salad dressing. This
Yeah.
is all what you're talking about,
the lower fat.
the lower fats.
But again, not to be misled because of that sugar-free or no sugar added label, you know, and that individualization. Diabetes, meal planning, pre-diabetes, better nutrition, however you want to focus on it. It's not going to be a cut and dry. It's not going to be the same for everybody. There's a lot of individualization.
Sure, sure.
And where I have one person who may be willing to go with maybe instead of whole milk, maybe skim milk.
Skim milk, right.
I may have another person that says, no, I'm not doing that, but I'm willing to maybe go with a lower fat
Right.
option for my mayonnaise or my salad dressing or whatnot. Like personally, I don't like the fat-free products, so I'd rather balance it out
Balance
some
it.
other way. So that's where it's got to be an individualized, you know.
But that's also, Ed, where the education comes in at from someone like you, where because the average person really, in all reality, they don't have the freedom to really think outside the box or the knowledge to know that they can do that, and that's why a lot of the lifestyle changes, when people try to do it, they're resistant to it and they give up.
Right.
Because they don't know that they, just like you said, you don't have to do skim. There's other things that you can do.
You can balance it out.
You
but
can balance it out.
it's like anything, until you know, you don't know.
That's exactly right. Let's go to the next slide. We touched about plates and portion size.
Yep.
Next slide. We talked about eating. Let's go to sweeteners.
Again,
we
the
talked
artificial
about.
sweeteners.
Yep. And let's go to, and we talked about drinking. So okay, let's talk about
Alcohol.
exercise.
Okay. Oh, exercise.
Let's talk about
All right.
exercise.
You know, sometimes like diet, people go, oh,
Right.
you know, we got to do a little more than we're doing.
We got to
Obviously,
exercise.
you know, incorporating, and I'm so proud of the regimen that you shared that
That's
you're
it.
doing, but it's like medication on the counter. It truly is. It helps to lower my level of stress,
Right.
insulin resistance. It helps with my blood pressure. I mean, there's so many benefits, but you've got to work with a healthcare team, you know, to really come up with a plan. And just to begin, if I park my car a few spaces further from the door when I go to church or to the grocery store,
You can get some exercise
I'm
in.
actually improving. If I'm watching my favorite TV show, like watching this show, right?
Right.
Standing up beside my chair is burning more fuel. Walking in place is burning more fuel.
Right.
Even sitting in a chair, I'm confined to a chair.
You can
Just
move a little
turning
bit.
back and forth in a chair.
enough.
We just got to start moving a little bit more.
So we got to add exercise. I think that the guidelines is goal is 30 minutes times 5 times a week. And you want to do something like you're saying, sitting in a chair, doing something like this here.
Yeah.
Even with your legs moving side to side.
Absolutely.
It all
And
adds-
these recommendations are from the DPP, which is a landmark trial that is referred to DPP, Diabetes Prevention Plan.
Okay.
And this is, again, a huge you know, undertaking that the government, I mean, NIH, CDC, everybody's involved with really putting this plan out.
Right.
Getting this plan out. We actually, at Columbus Regional, are going to launch a diabetes prevention plan program with the Georgia Department of Public Health that's based off of the DPP.
That's
but these
exciting.
guidelines are actually from the DPP because benefit is shown. So people can be overwhelmed. Oh, I got to do that many times a week. No, you got to start where you are.
There we
And you
go.
got to start and build and do it safely, because not everybody needs to be doing the same thing that someone else. We've got to look
You've
at
got to
our limitations.
customize it to yourself.
Absolutely.
If I can have you look in that camera right there and also tell them, so you can tell them again how they can get in touch with you to get all this good information and to be a part of a team effort where they're the captain of the team, but they can call them professionals like you. If you can look in there and tell them how they can do
You
that.
can call us at 706-321-3700. 888-278-3741. And, leave me your name, your contact information, and a message, and we will get back with you. You can also go to the Columbus Regional website, and you can get information there.
Good. Well, Ann, we're going to wrap this up. I want Ann to come back again because you see all the good information that she's given. I mean, a lot of fantastic information. But I want her to come back also because let me tell you something. Nutrition is the key. You are what you put in your mouth. You are what you eat. And you see all the good information she's given. I want her to come back and talk on some other nutrition, other topics. Celiac sprue, which a lot of people are confused about. One, Crohn's, specific things. A wealth of information. She wants to get the community healthy, and you can do it. Welcome again to our Focus on Health. We're glad that you had